Broadcasting from Detroit's Cass Corridor, it's the Metro on WDET. I'm Robin Vincent.
And I'm Tia Graham. Today on the program, Jessie Reyez has written music hits for some of your faves. Now she's writing her own legacy.
Her raw and radiant new album hits Detroit next week during a 44-city tour.
Plus, queer Latinos have long been at the heart of LGBTQ activism, but their stories rarely take center stage.
Today, we're exploring the often overlooked Latino voices that have shaped the fight for equality from within.
And Israel asked the U.S. to join its war against Iran. But intelligence officials say Iran isn't actively building a bomb.
We'll examine what's driving this conflict and where it could go next.
Plus, many descendants of enslaved people don't know their full family's history. To celebrate Juneteenth, a genealogist at Wayne State is trying to change that.
But first, Detroiters struggle with chronic illnesses and limited access to care. Against this backdrop, Wayne State University is opening the city's first standalone school of public health. The school is designed to train healthcare professionals who will embed in Detroit's neighborhoods. Construction is set to begin this fall on a $200 million health sciences research building with community input central to the operation. So, with public trust in health institutions at an all-time low, could this initiative bring about real and equitable change in Detroit? Dr. Bernard Costello is here to discuss that. He's Wayne State's Senior Vice President for Health Affairs, and he's leading this effort. Dr. Costello, welcome to the Metro.
Thanks for having me. I'm thrilled to be with you this morning.
So Wayne State's new public health school arrives at a moment when Detroit faces significant healthcare challenges, including higher rates of chronic diseases and lower life expectancy compared to the national average. Why is this school necessary right now?
Well, I think for many reasons. Detroit has been a place that struggled with health outcomes for a very, very long time. We are some of the worst urban health outcomes in the country. And we've been doing public health, community-engaged public health research for decades. This place, Wayne State University, was started as a medical school with that prescribed purpose to really help the people of Detroit, work with the people of Detroit, and be in Detroit, embedded in Detroit. So this school represents not only activity that's going on and has been going on for a while, but it's a new amalgamation. It's a new enhancement of what's been done to take it to the next level, to do more good work for the people of Detroit.
Let's talk about how the facility emphasizes local community input. What does that look like in practice? How will residents have a voice in research priorities, let's say?
Sure. Well, it was one of the big draws for me. I'm new here. I came 5 months ago from the University of Pittsburgh.
Welcome.
Thank you very much. And another urban setting where healthcare and community engagement is important as a value. But here, what I found right away, even during the interview process in the winter, was that it's a reflexive process for people here. This has been something that's been going on, engaging with the community and partnering with the community on these research activities for a century plus. And because it's a value that's reflexive for these folks, that's a real opportunity for this place to make a difference. It's been doing that, but we can take it to a whole nother level. This new building, the Health Sciences Research Building, which is just part of our portfolio, it's designed to have a first floor community engagement space where that partnership is going to be accelerated. It's a space where the community can come, help design research projects with us, and be a part of that in partnership, true partnership, with how we get things done for the people of Detroit.
That's really interesting to think about, that people could help to design research projects. Can you talk a little bit more about that to help us kind of envision it?
Yeah, sure. So people that are community engagement scholars at universities countrywide look to Wayne State University as an exemplar. People here are exceptionally good at this. And again, it was one of the big draws for me. So to do that right, it's not about the university parachuting into the community and fixing problems because we're so smart and we have the answers. Turns out we don't. And that community partnership really emphasis on the partnership is really the key to getting these studies done the right way. Not just so people are engaged in the research, so we get the right answers and we get the right folks involved in these studies, but that we're asking the right questions and doing it in the right way. And that trust that exists between the community and our investigators, our people that ask these questions, that's a key element to this. That takes decades to build. There are lots of high-flying universities that are ranked very, very highly in this country that would love to have what Wayne State has in this regard, and we do that exceptionally well.
I'm wondering if this is an approach that you were taking in Pittsburgh. I realize you were doing some transformative work there. I'm wondering how people-led investments might have brought about change there if you were working on that.
Yeah, I would say that most universities like the University of Pittsburgh can learn from what Wayne State has already been doing here for decades, and the approaches are similar in other urban communities. So yes, it's about a university investing in space and in time and in efforts with and for the community, in the community spaces, partnering with other community groups and locations like churches where that trust can be developed over time. Here, again, that's an existing process, and we have people embedded. So the building that you referenced, for example, the Health Sciences Research Building, we have community meetings scheduled to talk about the impact of just the construction. You know, what's that mean to the community? What are the concerns? We have that dialogue, and there's trust there. It's not something that we need to bring and start anew, which lots of universities really have to work at much harder than Wayne State.
That really does make a difference to have that kind of community trust, which can take a very long time to build. I want to stay on the topic of local communities and what they're facing here in Detroit, and that includes a lot of barriers to healthcare access. I'm thinking about transportation and cost. Those can really contribute to stark health disparities. So how specifically will this new school address those kinds of everyday obstacles?
Well, I think having been on both sides of the equation, meaning on the university side where we teach and learn about healthcare and how to really do it in a best way with and for the community, but also on the health system side, being a surgeon, trained as a craniofacial surgeon that does cleft lip and palate work. I've seen it from that lens too. And health systems are very focused on making sure that they can have the resources necessary to provide the care at the level that they want. It's not always necessarily focused on those barriers. At the university, particularly at a place like the School of Public Health, that is the focus, that we make sure that we look at those things in the community that make it hard for us to access care. And in Detroit, that's lots of things. That's maternal fetal health. That's challenges with mental health services. And we have many, many projects, many people embedded in the community to make those things happen at a much higher level. So that's about showing our students how those things are done at the highest level in the right way, and then bringing it to the health system so that those values continue to be in the environment. It's not always the focus of most major health systems to think about these things because a lot of the revenue is sort of made with the services that they provide, high-level, very complicated services. And it really needs to be the whole package. It's one of the challenges in American healthcare is to make sure that we look at those barriers, we make sure that we look at the community engagement, and make sure that that's part of the equation, not just can they get super high-level care done well without any medical errors, for example.
Sure. A lot of the things you're talking about have been left out of the conversation, though we are seeing strides being made in another direction. And this sounds like one of those examples. When we think about public health, I'm also thinking about vaccines and vaccine hesitancy and misinformation, which remain significant issues, especially as national debates intensify under Health Secretary RFK Jr.'s controversial stance. He has a long history of vaccine skepticism. How will your public health school actively tackle these issues within Detroit communities?
Yeah, it makes me think of what I was doing last week. Last week I was visiting Seoul, South Korea, and I went to a university called Yonsei, which is kind of like their Harvard or Yale. It's a very, very competitive place. Their motto is "The truth will set you free." And it's on all their T-shirts. And that element, is sort of a simple phrase, but it's really what we do when we think about answering questions at universities. What's the real truth behind these things? How can we investigate it and really bring truth to the conversation about if we have skepticism, can we answer that question? And can we provide that information in a digestible way, not in some university speak, to the community and with the community, so that we can leverage that trust that we were talking about in a way that helps the health process. So if it's about vaccines, for example, and we have good evidence that vaccines are effective in a particular area, we want to make sure that the community hears that in a way that they can understand, not just in a nightly news bulletin, but can they ask questions? Can they ask questions of somebody that they trust, and namely our practitioners?
You're listening to the Metro on WDET. I'm Robin Vinson. We're talking about a new school of public health that Wayne State University is launching in the coming months and what it means for Detroit residents. Our guest is Dr. Bernard Costello. He's Wayne State's Senior Vice President for Health Affairs. Dr. Costello, large-scale healthcare projects often promise benefits to underserved neighborhoods, but sometimes they fall short. What measures will you put in place to quantify how effective this project is at helping the people who need it most, doing some of the things that we've been talking about?
Yeah, great question. So when I think about some of the most exciting things that I've heard about in the last 5 months, just doing my listening tour, meeting folks along the way, I think of folks like Dr. Phil Levy, Dr. Haley Thompson. These are folks that are embedded in the community, that are doing high-level research with and for the community in the ways that we're describing. Providing those services, providing those opportunities to folks, and doing it in a way that continues to bring that conversation forward. So the nature of what Phil does, for example, community health vans that are brought right into the community to deal with some of those barriers of gaining access, and Haley's work in cancer screening. Some of the work that we'll do in both of those areas has to do with what Haley Thompson's doing with digital literacy, having people in the community have a higher understanding of what AI means for the future, for example, and how Phil Levy can leverage some of that opportunity to really look at high-level data analytics with Google, who's one of our partners in this, in assessing the data from the community and really understanding where we can make the biggest difference. So if we're treating high blood pressure, for example, he knows the pockets where we can visit, where we can be most effective, and which interventions are the most effective. Haley has that from the cancer care and cancer screening standpoint. So that's how we use, our power of data analytics with and for the community.
We've had Dr. Levy on the show several times here on the Metro. Say Dr. Haley's full name. It sounds like she's someone we need to be speaking with as well.
Yeah, Dr. Haley Thompson works at the Karmanos Cancer Institute. It's our NIH-funded institution. It is a key cancer institute, an NCI-designated center. There's only 2 of those in the state of Michigan, ours and one up at the University of Michigan in Ann Arbor. Her primary focus is looking at health inequities from the lens of the Cancer Center. So she works within that group, that multidisciplinary group that works together for beating and fighting cancer.
Dr. Costello, I'm glad you just brought up federal funding. Because we know federal agencies like the Centers for Disease Control and the National Institutes of Health, or NIH, are facing steep proposed cuts. CDC funding is slated to drop nearly 50% and NIH by around 40%. Advocates have warned that these reductions could really disrupt training pipelines and that they could threaten school operating budgets. Could these federal funding cuts affect the construction, opening, or the long-term viability of Wayne State's School of Public Health?
Yeah, I think about that a couple of different ways. So broadly for the university, even independent of the School of Public Health, research is a primary focus of what we do. Wayne State University is an R1 research-focused institution, which means that we're at the highest level of research for places that get ranked in research. And that is a major part of our mission, to solve the world's most difficult problems through research. If we don't have that funding, we can't do that research. We can't answer those questions. We can't solve those problems. And the U.S. has been very, very good at this, particularly over the last century, in having universities really drive that process. That squelching of that opportunity is really a threat to solving those problems, curing cancer, lots of other issues that are important. So the School of Public Health does have the resources to be able to get started. We have the funding committed both for the build out and renovation of space and for having students with exemplary faculty. We have a lot of those things in place already. So I'm not worried about the funding from that standpoint, but the grants that those faculty will get, that could be affected by these cuts for sure, and that's a major focus for us. We don't just study the problems, we're in the community helping solve those problems through that research. That's a very unique thing about Wayne State, too.
My gosh, as a person of medicine, of science, of public health, I am wondering if you are personally concerned right now as we are hearing more and more proposals about federal cuts to some of these anchoring institutions in the U.S.
Yeah, for me, that's a really critical conversation for us to have right now. And make no mistake, I'm all about efficiency. I think it's a reasonable thing to ask the question, can we be more efficient at universities to do what we need to do, and including in the research space. However, the level of cuts that they're talking about to Medicare and Medicaid, which also affects some of our operation because we work with health system partners, are going to be under immense pressure if these cuts go through, particularly in urban settings, particularly safety net hospitals, like we see with the DMC and with McLaren's hospitals and Henry Ford and others. That's a major factor. But also in the fundamental research for these spaces. It's really a critical thing that this continue. Again, happy to have the conversation about how we can be more efficient in some of those spaces, but sometimes the narrative stays at the superficial. So, for example, a lot of people talk about this sort of overhead costs, right? And we could just cut the overhead costs. My analogy with that would be the grant money is not just the gasoline that goes in the car to make it go. The grant money also supports the fact that you need to own a car in the first place to be able to drive it. So our buildings, our infrastructure, that's the car. We can't do it with just the gasoline and a little less gasoline at that. They need to provide the funding for all of these things. We can't support that by, say, increasing tuition rates to pay for buildings for students. College is already pretty expensive, even a place like Wayne State. So that support's really critical for us to continue to do research.
So it sounds like this is sowing a certain amount of uncertainty, though, and concern for you and others who are working in these spaces. And it feels a little bit like a wait and see kind of scenario.
It does, although I'd add that we've been very active in this space. I've been talking to legislators. President Espy's been talking to legislators. A number of our other executive team members have been doing the same, both in Lansing as well as D.C. And I will tell you, folks from both sides of the aisle have been very, very open to those conversations, and they understand the critical importance of this. The question, in my mind, becomes, where does the negotiation go? So it's not a passive approach for us. We're definitely active.
I want to look for one moment at the local medical ecosystem. You mentioned Henry Ford, which is investing $2 billion right now into healthcare in Detroit with a new hospital expansion. How do you see Wayne State's new School of Public Health fitting into this new ecosystem?
Oh, great question. So one of the other really fun things I've had the opportunity to do over the last couple of months is meet people from the health systems and a lot of the key leaders there. And I've spent time with the folks at Henry Ford. It's a really great team. They have a great platform. A lot's been talked about with Michigan State in the community as well, and the partnership with them. There's plenty of work, regrettably, to go around. There's 5 million people or so in the metro area of Detroit, about 10 million in the state. There's lots of partners trying to take care of all of those folks, and there's lots of work to be done. Henry Ford's very open to working with us, particularly on the School of Public Health areas. It's when we started, it'll be the second School of Public Health in the state of Michigan. The only other one is up at Ann Arbor. And as I mentioned, the differentiating thing with our school, which is what makes Henry Ford interested, is the fact that we're in the community doing this work, not just writing papers, not just presenting at conferences, but making change and improving the health for the people of Detroit and Michigan at large.
Let's stay on that idea of improving the health of people in Detroit and Michigan at large. I want to have you, Dr. Costello, sort of envision the future for us a little bit, if you could. I'm thinking about recent public health crises, including COVID-19, and how your students are going to be uniquely equipped to handle some of these unpredictable future challenges in ways that previous generations of public health professionals were not. We know that the COVID-19 pandemic so sharply has been transforming public health and the way that people in public health interact with the public and the messaging that they use? Talk about how you want to, again, equip this next generation in a different way.
Yeah, great question. So I was the dean back in Pittsburgh when COVID-19 was happening, running a healthcare enterprise, including a faculty practice. And it was an exciting time, to say the least, watching Fauci and Birx try to navigate the country through all of these things. And, what I found was something that I've been sort of working on, from an academic perspective for a while, which is that healthcare tends to be very siloed, and we have a hard time getting people to work together. So one of my primary focuses is making sure that team-based healthcare is something that really gets accelerated. And I think that's what students really need for the future. That's including folks from the public health space. Public health work is not just biostatistics and analytics in some sort of dry lab somewhere not associated with patients. It really needs to be embedded in the entire process with the practitioners, with a health system like Henry Ford or Tenet or others, where we're doing the work with and for the patients, and that those students are experiencing it with the practitioners as public health experts. That allows it to be translatable, allows it to be practical. You really see the results. It's more exciting that way. So yes, we need them trained up in virology and vaccines and all sorts of public health-oriented things that are granular, but we also need them working together. And that's really critical, that they be embedded in hospitals. There's a huge need for public health workers. There's a need in Michigan, but also nationally, and particularly in urban settings. And our students are already set up in the programs that we have existing to do that very, very well. They're very desirable to these entities. The school will make it even more so.
And when you say public health workers, you mean epidemiologists and who else? Oh,
it covers a wide variety of things. So there are policy experts, for example, that are trained in public health, so that when folks are crafting policy in Lansing or in DC that have anything to do with public health, like vaccine or misinformation or any other number of other things, and insurance regulations, that it's well informed from people that have specifically studied these areas, that have looked at insurance claim data, that have looked at outcomes for what sort of interventions make a difference, actually make change, actually improve that health of the population. So then that's just one area. There's lots of areas besides, just crunching numbers that have to do with public health things.
Before we let you go, construction on Wayne State's new School of Public Health is set to begin in the fall. When will the school be fully operational?
Well, as you might imagine, there's a lot of steps involved in building a new school. You can't just decide that you're going to do this and say, here we go. There are regulatory things. There's all sorts of paperwork to fill out. And that all has a very good reason. We want the curriculum to be robust, which we have many of these elements, but there's work to do around that. Those processes, which involve the Department of Education and DC and a number of others, they take a little bit of time. We expect to be able to launch the school by the fall of 2026. There's a construction project for the new research building, which is really for all of the health sciences. That'll start in the fall of this year, in 2025. We expect to have a shovel in the ground sometime in September for that, right over by the medical school off of Canfield. But the School of Public Health will be an ongoing project that really just expands our current activity in public health and consolidates it and brings it together into a separate building. And that'll occur, we hope, by the fall of 2026.
Dr. Bernard Costello, Wayne State University Senior Vice President for Health Affairs. Doctor, thank you so much for joining us on the Metro.
Oh, the pleasure was mine. Thank you.
From the WDET newsroom, Michigan State House Speaker Matt Hall reportedly says he agrees with federal cuts to Medicaid and food assistance programs. Congress is considering them as part of President Trump's so-called Big Beautiful Bill. Hall was with a group of Michigan GOP lawmakers who met Trump administration officials yesterday at the White House. He told the Detroit News Governor Gretchen Whitmer needs to, quote, spend tax dollars wisely, pay out accurately, and they won't get penalized. The proposed cuts could have a big effect on Michigan's state budget. Lansing lawmakers have yet to agree on an overall spending plan. just weeks before a self-imposed deadline of July 1st. Coming up, last week, Israel went to war with Iran, claiming it wants to destroy its nuclear capacity. Iran has since retaliated. Now, hundreds of people have been killed, most of them Iranian. Israel is using American-funded weapons, and now it's calling for the U.S. to get involved further. We'll explain why all of this is happening next. We'll be right back here on the Metro. Stay with us.